So myths about breast cancer, setting the record straight. Okay, only women get breast cancer, true or false?
False.
No. According to the National Cancer Institute, in 2009, almost 2,000 men were diagnosed with breast cancer, and of those, 440 died. So it's rare. It is rare, but they do get it. And the problem is, see, men don't have screenings. They're not, doing their breast checks regularly. So it tends to be a little bit more fatal for men because they catch it at really late stages. By the time they find it, they're like, oh, what's this? And it's, like this big. Women with family history of breast cancer have a higher risk. True or false?
True.
Go ahead. False. 80%. It can mean a higher than average risk, but more than 80% of all women diagnosed with breast cancer have no family history. So, just because you don't have family history, don't say, oh, I don't need to get checked, I don't need to do that. It really is meaningless. 80% of all cases, no family history whatsoever. Breast cancer is mainly a genetic disease. No. Only a very small percentage, 5 to 10% of all breast cancer cases are thought to be from the BRCA gene. And this tends to be found in women of Jewish Ashkenazi descent. It's very, very common in women who are of Jewish Ashkenazi Jewish descent. I'm not sure if I'm saying that right, but you'll see it a lot in that. But it's a really, really small percentage. So a breast lump means cancer. No, absolutely not. Fortunately, 80% of all lumps are caused by a benign changes in the breast, mostly fibrocystic changes. Some women have it worse than others, but of course, any lump you feel, you definitely want to have it checked out. So women with lumpy breasts often have a higher risk of developing breast cancer. True or false?
False.
Okay. Women with lumpy breasts often suffer from a condition called fibrocystic change. Now, the problem, though, for women who do suffer from this is that they do have very lumpy breasts, and so there's always that fear that we can't overlook one. So they tend to have mammograms more often than women who don't, which does then increase your risk a little bit, but just in general, no, it doesn't. Small-breasted women aren't as at risk for breast cancer. True or false? False. Size is not a significant risk factor. In fact, small-breasted women have an advantage because they're going to feel that lump a lot sooner than those of us or women who have large breasts. Removing the entire breast gives you a better chance of surviving cancer than having a lumpectomy with radiation therapy. True or false?
False.
Sure. Go ahead, Kimberly. Nope. Survival rate is about the same for women who have mastectomies or for those who choose the breast-conserving methods. Keep that in mind if you know anybody, because I have 2 friends who were diagnosed with stage 0 ductal carcinoma. That means that these aren't even cancer cells, they're atypical cells. And the recommendation for both of them, mastectomy.
That's right.
And it does not change your survival rate, nor does it change the recurrence rate. So have them think long and hard before they do this. And neither one of them did their doctors tell them this. One of them, she's an attorney, she started doing her own research, she found this out. She went back to her doctor, and he said, well, yeah, that's true. She said, well, why didn't you tell me? And he said, well, because this is just what we recommend.
I had a patient that her mother and 2 sisters both had breast cancer, and she had nothing wrong with hers, but they still did 2 mastectomies on her.
Yeah.
Oh my gosh.
Well, yeah, if you've got, especially if you test positive for the BRCA gene, they recommend that not only do you have both breast removed, but that you have your ovaries removed. Oh yeah. Oh yeah, it's go ahead. So low dose radiation is safe, true or false? Radiation is radiation. It accumulates in the body. When we have, anytime you go in for an X-ray or a mammogram and you are X-rayed and exposed to that radiation, it stays in your body. We don't detox it out, it accumulates. So they're saying that between, if a woman starts to have annual mammograms at 40 and has them every year, for 10 years, she has now increased her risk of developing breast cancer by 20% just due to the radiation exposure. Yeah. So, and they say, oh, it's low dose. It's radiation, and it's a scatter radiation. Typically, when you go in for an X-ray, they're X-raying your arm, and there's a dense bone in there. They can see that. This is tissue. So they have to do an ionized scatter radiation. So it's not safe. I mean, they'll tell you, oh, it's low dose, I mean, studies have shown 20%, 2% each year that you have a mammogram.